Hello and welcome to the Emergency Medicine Residency at McLaren Oakland Hospital. I'm the Program Director, Dr. David Minter, and I'd like to take a few minutes to talk to you about why we think our program's so special and what we can offer you in your residency training. When considering an emergency medicine residency, there are a lot of factors to consider. Features of a program that works for one learner might not work for another, so today we're going to help you answer the question, is this a good fit for you? To do that, we're going to talk about who we are as a program, our history, our patient demographics, what we can offer you in training, from our curriculum to our faculty, and then what to expect out of living in Pontiac, Michigan, lifestyle and culture. First off, a little history, if you'll indulge me, since we're an older institution with a proven track record. McLaren Oakland Hospital was originally known as Pontiac Osteopathic Hospital, which was founded in 1953. Pontiac, Michigan was even the home to the formation of emergency medicine as a specialty via the Pontiac Alexandria Plan, which is when 23 physicians in 1961 left their private practices in order to staff emergency rooms. Our emergency residency itself is one of the oldest DO institutions in the country, accepting its first resident in 1979. But time marches on, and POH changed its name to McLaren Oakland after being bought by McLaren Hospital System in 2012. This has given us an even wider reach with innumerable modern resources, and transitioning to an ACGME program in the 20-teens has likewise given us the privilege of expanding the pool of residents that can benefit from our long experience. The philosophy of our residency is elevating resident confidence and discourse through foundational knowledge and experience. We have a strong tradition in academics with a structured, evidence-based medicine curriculum that will fill any gaps in your medical knowledge. Our residents love our didactics. We have protected time with our residents and a high faculty attendance rate. We employ a flipped classroom approach to learning, maintaining engagement with mock cases and procedure days. We're affiliated with Michigan State University, specifically their statewide campus system, which provides us national speakers. We're hoping you're going to be the next generation of teachers, so we implored a Residents as Teachers series to make you the most effective and entertaining speaker as possible. When I said our philosophy is elevating resident confidence through experience, you're going to be busy in our emergency room. We are a smaller patient volume, but our residents see about 90% of those patients, and we give them as much autonomy as can be safely allowed. Our critical care volume is about 3 times higher than the average ACGME standard. Practical application, getting in there, seeing pathology, we've always felt is the best way to learn, so you're going to be getting great cases right away. So your first case might be a stroke or a STEMI, or you might be like me and have to pull a bug out of somebody's ear like I did my first day. We highly encourage our residents to disseminate their knowledge as much as possible, whether it's through our mentorship program with the junior learners or through the steady flow of medical students that are visiting our residency. Besides local teaching opportunities, we also have the opportunity to teach at Michigan State University's College of Osteopathic Medicine. Now to talk a little bit about the curriculum itself, we have a sliding progression of 10-hour shifts during your residency to allow for a little bit more flexibility. 20 shifts your first year, 19 your second year, and then 18 your third. We find this helps a little bit better with work-life balance, pursuing teaching or research, or possibly externally moonlighting your third year. During our first year, we want you to get as much exposure as possible, so we have 9 dedicated emergency medicine shifts, one of which is geared toward ultrasound. In PGY2, we have a dedicated trauma month to help you sharpen your skills. We have a dedicated toxicology month at the Poison Control Center at Detroit Medical Center during your PGY3 year. During your PGY3 year, there's 2 additional elective opportunities for you. This is a list of some of the in-house opportunities that we have. Medical education and advanced EMS are newer rotations. Observation medicine and advanced ultrasound are well established. We also give you the opportunity to explore opportunities outside of our hospital system, anything really to assist in your education. We have a dedicated and excited core faculty staff. Dr. Martina Giardi is our associate program director and a whiz with quality improvement projects. Dr. Eisenbray is our director of curriculum. His job's to make didactics as entertaining and engaging as possible. Dr. Palazzolo is our clerkship director who also helps out with procedure days. Dr. Bakari specializes in well as any remediation of any learning struggles you may have. And Dr. Robert Modes is our newest faculty member who's in charge of our ultrasound curriculum. Now, a little bit about Pontiac, Michigan, if you're unfamiliar. Like many areas in Michigan, it's a former industrial hub, and it's fallen on some hard times and certainly seen better days. The location of Pontiac's about 30 miles north of Detroit. Its population is about 60,000. Racially, our population as of 2022 is 48% Black or African American, 22% white, and about 18% Hispanic. The average household income is 34,000, and about 27% of our population lives below the poverty line. 13.5% of the population is uninsured compared to 8.4%, which is the US average. Our violent crime rate is about 3 times higher than the national average. Our blunt to penetrating trauma ratio is something similar you would find in a major metropolitan city, not a city of 60,000. Our HIV prevalence is similar to that of Detroit. Our primary care physician to patient ratio is 690 to 1, meaning that if you're seeing a patient in the emergency room, sometimes it's the first time they've seen a doctor in 20 years. Historically, Pontiac fever, which is a Legionella infection, was named after a 1968 outbreak. So what does all this demographic information mean to you? It means lots of interesting pathology. McLaren Oakland is a level 2 trauma center where you do it all. The ACGME mandates that residents have to learn about mass casualty events, but in Pontiac we actually have them, where we were the primary site for the victims of the Oxford school shooting.
My name is Mars Alexander, and I graduated from McLaren Oakland in 2023. I was the chief resident in my last year of training. I work in Florida now, where I feel very confident to handle any high priority trauma or medical case that walks through the door. I feel like this is due to the leeway our attendings gave us in residency, which just allowed me to develop a lot of confidence in myself.
McLaren Oakland is a dedicated PCI center for ST segment elevation MIs, as well as a stroke center. We're a smaller program with 6 trainees per year, but McLaren Oakland is a home to many residencies and fellowships, which is a great opportunity for collaborative learning. It's also a friendly and inclusive place where programs all get along well with one another. We have community outreach through McLaren and lots of dedicated wellness events. We have a dedicated wellness event probably every few months now. In addition to a welcome party, we have Sona Wars, we have a resident planned event after the in-training exam, as well as a Women in Medicine Day and a interdepartmental event. Speaking of lifestyle and wellness, Michigan has a lot to offer if you're unfamiliar with the area. Outdoor activities like fishing, boating, hiking, sand dunes, which tend to be on the west side of the state. I probably didn't make Pontiac sound like a very nice place to live, but there's actually a lot of cities that are a short drive away that have a lot to offer. Oddly enough, Pontiac's located in Oakland County, Michigan, which is one of the richest counties in Michigan. For example, Birmingham, Michigan is full of high-end restaurants, expensive homes if you're looking for something a little bit fancier. Rochester, Michigan has a bustling downtown with a bit more of a country feel if you want a little bit more space to live. Dr. Palazzolo would be remiss if I didn't mention the big bright light show that they have every Christmas. Ferndale, Michigan is a bit more up and coming place to live. It's a little cheaper. There's lots of music venues, nightclubs. I personally prefer Royal Oak, Michigan, because that's where I live. Lots of breweries, restaurants. There's a music theater here. The Detroit Zoo is located here. Lots of safe neighborhoods if you have kids, tons of parks. And pretty much anywhere you live will be close to downtown Detroit, which has all the benefits of being in a major metropolitan city, from major concert events, major sporting events, the Pistons, Red Wings, Lions, Tigers, there's casinos, there's lots of high-end bars, restaurants, pretty much anything you could think of to do in a city. So now to some final thoughts. Thank you for taking the time to check out our residency. We have a long, proud tradition in emergency medicine. We're excited about our academics and our teaching. We have an environment that's perfect for the aspiring physician with great pathology and a relaxed culture. So we're hoping you're considering us for your residency, and we're looking forward to speaking with you in person.